Welcome back, everyone. World Menopause Day is this upcoming Friday, October the 18th, and the day is to raise awareness about menopause and options available for improving health and well-being. And joining us today to talk about it, we have Dr. Samina Rahman, who goes by Dr. Sam, as well as I Know Girl on Instagram. Thank you for joining us this morning. And how are you doing, first of all?
Great. Thank you for having me. I love coming over here.
Yeah, absolutely. Okay, so even in 2024, I feel like menopause, there's still kind of this dark cloud over talking about it, still a stigma associated with it. And so I think when a lot of people think about menopause, they just associate it with hot flashes and mood swings. But talk about some of the overlooked issues when it comes to this stage in life.
I mean, there's so many overlooked issues, and I would say there's the complaints that I get in my office are vast beyond hot flashes, night sweats. Sleep disorders are really big, irritability, mood disruption, depression, anxiety. There's a whole syndrome related to musculoskeletal syndrome of menopause that one of my colleagues, Dr. Vonda Wright, coined this year, actually, related to joint pain, frozen shoulder, you know, a lot of issues around the musculoskeletal health, your bone health. And I think there's issues around genital urinary health that's oftentimes not even acknowledged. Urinary frequency, urgency, recurrent UTIs, sexual pain, all the things that we know exist, but people don't actually talk about as much.
My goodness. I mean, women go through a lot. You just, you don't often hear about that. I mean, and so many of the different issues that you just brought up, you'll hear people mentioning those types of things, but I would never think to associate it with menopause.
Yeah, I mean, the reality is we have estrogen receptors from head to toe. So estrogen is all over our body. When we lose estrogen, which menopause is a state of hormone deficiency. We've lost the estrogen that we've lived on for the majority of our life, and most women live a third of their life in postmenopause. So it has a dramatic impact on our overall health, our bone health, our cardiovascular health, and our brain health. So it's very significant, actually.
All right, so what type of treatments can you advise and recommend as a doctor that can help ease women through this natural process?
Yeah, I mean, it is a natural process, and there's a whole toolkit that I utilize for my patients, including looking at things like what they're eating, the type of exercises they're doing, stress reduction, sleep improvement. That is a big overlooked thing. And of course, there's issues around, using medications like menopausal hormonal therapy. And the right candidates can be life transformative.
And I know you mentioned that, of course, every woman is different, so everyone's plan is going to look different. But would you recommend, a mix of natural, like you said, diet as well as exercise? And then you mentioned there's some hormonal and non-hormonal treatments that can be recommended as well.
Yeah, and I actually approach it in a really precision fashion where I look at the patient as a whole and see what would work best in their life and how they'd benefit. I mean, vasomotor symptoms like hot flashes and night sweats have to be treated, and the best treatment is menopausal hormone therapy, estrogen or alone, or estrogen and progesterone if you have a uterus. And so I take into all these considerations, we call it precision medicine, when we're looking at the patient as a whole and considering everything that can help them. And for a lot of women, it is menopausal hormonal therapy, but we don't use that in a vacuum because there's no magic bullet when it comes to getting through this stage of life.
Right, and we've got about 30 seconds or so left.
Okay.
And so I know you also mentioned that, genetics and obviously family history play a big role in how women will experience menopause. What types of things can younger women do potentially to ease menopause when they get to that point in their life?
Yeah, I mean, I think it's really important to have conversations with the women in your life, whether or not it's a mom, a sister, or anyone that's gone through it already. But also just understanding what other risks you have. Are you smoking? What kind of diet are you utilizing? Environmental factors and toxins that might be contributing, and looking at your overall health picture to make sure that you're going to ease through this in the best way that you can. And finding the right clinician and someone to help you with that is really imperative.
All right. Well, I'm so happy that you joined us this morning, giving us some great advice.
Thank you so much.
Yeah, just educating me a whole lot on some things that I didn't know. So I appreciate you being here, Dr. Sam.
Thank you so much.
All right. Well, again, thank you, Dr. Sam, for being here. For more information, you can visit cgcchicago.com. You can also find Dr. Sam on social media.